Got it. All right, thank you. Good evening, everyone. Thank you, first of all, for being here with us this evening. This is, quite honestly, a very exciting day for Cincinnati Public Schools. You all probably recall, I know you do, that the last 10 weeks of the school year, our buildings were closed and we were in a remote learning atmosphere. And so we're really excited that the board has come together to make a decision about the upcoming school year and helps give us direction for a way forward. So we know also that this coming Friday, the governor plans to lay out his plan for reopening schools, and obviously we'll take his thoughts and his plan into consideration as we continue planning for the upcoming school year. As I think about the work that we started, detailed work really around how do we reopen our schools, about 4 weeks into the pandemic after our school buildings were closed, we decided to make a shift, to pivot to the future and looking forward. And we put 2 teams together, one team to really look at the logistics in terms of reopening, and another team to look at the future of schools and Cincinnati Public Schools that could, as it will, include remote learning. So I'd like to take the opportunity to thank the board for their vision, for their wisdom, for their persistence, all of the really great questions that they asked us all along the way. They have been true leaders and pioneers in this work, and the administration truly appreciates you, and thank you for your work and service. I also want to say a really big thank you to our parents and our community members, as well as our staffs. So for our parents, I know how challenging remote learning was. I was in that exact same situation. I was at home with a 9-year-old who was trying to do her work and get on Google Meet as I was trying to do my conference calls and video conference calls as well. And so parents, I really understand how challenging that was. And for our staff members, I cannot say enough for our dedicated staff. Our teachers and principals and paraprofessionals and lunchroom staff who all really came together to make sure that our kids were fed and that they were learning. I also want to thank and say to our families, we heard you. We understand that this is a very hard decision, and we appreciate the information you were able to provide for us. And we also understand and appreciate that from the information we received, our parents were kind of split. There were many parents who wanted us to go back full time, and then there were some parents who said, you know, having kids in session with less than 6 feet of social distancing doesn't really work for us. But what I'm really excited about is the fact that within Cincinnati Public Schools, we have lots of options and opportunities for all families. So that the board considered several different options. The administration, I believe in the last couple of weeks, gave the board 7 options to consider. And we know that through all of the options that there is a need for us to be flexible. We have to constantly look at our data, and I get data on a daily basis as to our community in terms of the confirmed cases and the recovery, and unfortunately, I also get the information that tells about the deaths that are taking place within our own communities. So we know that with the plan that the board has selected, a remote option will have to be a viable one. As we consider that over the course of this next month and a half, we may see an increase, as we have seen in the last several weeks within the Hamilton County area. We also have come to grips with the fact that there's the potential for a quick school closure, quick classroom closure, quick school closure, quick district closure. And so we have a plan in place for all of those should we need to be able to close down classrooms very quickly, an entire school, or the district. Again, we will rely heavily on the data to inform our work moving forward, and we'll be prepared to make any mid-course corrections that are needed. I can't say enough how important choice is for our families. And so we're very excited that the board has decided on a blended learning option. So with this option, a student will be in school face-to-face 2 days a week, 1 week, and then 3 days a week the next week. This will allow us to have 6 feet of social distancing to be able to offer half of our kids to come back into the building at any given time. This is in alignment with the CDC's recommendation of 6 feet of social distancing. This will allow our students also to be able to have face-to-face interaction with their teachers on a weekly basis, in addition to capitalize on our innovation as it relates to remote learning. We know that we have a lot more work to do as it relates to remote learning, and so we're up for the challenge and excited about this opportunity to totally disrupt the system that was already disrupted by the pandemic earlier last school year. For those families who are not convinced that the blended learning is the option for them, we will also offer the Digital Academy, which will be a completely online school for our students to be able to take advantage of, and that will be for kindergarten through 12th grade. So if you want additional information regarding Digital Academy, you go to digitalacademy.cps-k12.org, and you can find additional information about that academy there. We will be doing some revamping of the curriculum and the services that are offered in that academy. In addition to the fact that I think it's important for everyone to know that we have revamped a lot of our curriculum already. So we're a couple of years into a new social studies adoption, which has a huge remote learning component to it, so we'll use that, as well as a new English language arts adoption, which has a digital component. And this upcoming school year, we will introduce a new math adoption, and all of those adoptions have a digital component. So no matter what, whether we're in session from the very beginning of 2 days a week to 3 days a week, or we're completely remote at the beginning based upon the numbers in Hamilton County, we'll be ready. As I mentioned, we'll constantly analyze our data to make sure that we have the most current information to make very quick decisions. We will also be working with our parents to identify childcare that many of our families may need as a result of students being in school 2 to 3 days a week over the course of the school year. Parents, we still want to hear from you. We want to hear from you in terms of what worked with remote learning and what can we do to improve, because we're going to be in this blended environment for at least a little while. So we are excited to be able to hear from you. During the blended learning, or actually the remote learning that we experienced back in the spring, we did hear from parents about consistency from classroom to classroom, from school to school. And so, again, we did hear you, parents, and we're working on making sure that we have consistent standards and practices across all of our schools from classroom to classroom. In addition, our parents said, we wish that you would have communicated with us even more than you already did. And so, parents, we will establish a cadence so that you know exactly when to expect your robocall, your email, a direct communication from your school. And so we need to make sure, though, that parents, we have your up-to-date current information, email addresses, phone numbers, as well as home addresses, so that we can be able to communicate with you about what's happening. As we think about safety and health, because I've talked about curriculum, it's important for everyone to know that we are so lucky and blessed within Cincinnati to have Children's Hospital as one of our partners. So Children's Hospital is known as one of the top children's hospitals in the nation and actually around the world, and they are working side by side with us to help us put practices into place to be able to bring not only our students back safely, but also our staff members. And as we work with the Children's Hospital, make sure, or you can be assured, that we are also referring to the CDC guidelines, as well as the World Health Organization, as well as using the American Association of Pediatrics data and research to inform our work. Part of our protocol will ensure mask wearing, health assessments, and then being able to quickly contain a person who is showing symptoms. As we think about technology, we have a one-to-one initiative, and starting in the month of July, we will be deploying devices to our students, all of our students grades 2 through 12, so that by September the 4th, all of our 2 through 12th grade students, or grades 2 through 12, will have access to a device. Those devices will be able to be picked up at schools during the summer months, and so we're excited about that, because we know that devices will be needed for our kids to be able to access the curriculum. In addition, we also recognize that there are some students who do not have access to Wi-Fi within their homes. And so we have a partnership with many organizations to bring Wi-Fi to our families. We know that there are approximately 11,000 households without Wi-Fi. And so we're starting a proof of concept with 5 schools in which Cincinnati Bell has come to us with an offer to be able to provide Wi-Fi for an entire year for a rate that's pretty reasonable. But our community, as blessed as we are and as generous as they are, have come to us and said, we will support those kids who still need coverage in terms of that fee for Wi-Fi. And so many of our partners are coming together to pay for free Wi-Fi for our students for an entire calendar year, so for 12 months. So we are going to start with 5 schools. We'll continue to add more schools as we progress throughout the summer months. So today's announcement is only the beginning. And I will say it's only the beginning, but we didn't just start working on this plan. So we've been planning and working for several months. Now that we have a clear decision and a guide from the board, we know exactly what our next steps are in terms of surveying our families about their needs and wants for the upcoming school year, as well as our staff members, to ensure that we have a plan for every single person within our district. So stay tuned for more information as it relates to surveys that will be coming out. But again, families, I cannot stress enough, we need your current updated information. So you can call into our customer care line, 363-0123, to give us that information. You can send an email to our customer care department. We have to have your updated information so that we can communicate with you on a weekly basis. So, as you walk away from today, there are some key messages. Families have choices, and we have heard you loud and clearly. We will have a detailed plan that we will monitor on a daily basis to ensure that we are using data to inform our instruction and our practices throughout our district. And the last thing is, last plug, parents, we need your up-to-date information. Thank you to everyone, to our board members, to our communities, to our families, to all of our staff members who have really come together in this really very challenging time to support our kids, to uplift the importance of education within Cincinnati. Thank you. Yes, so when our buildings closed in the spring or March, we set up a program, Food Hubs. So we currently still have 23 food hubs that are operating across our district, from as far west as Sailor Park to as far east as Mount Washington. And so families and kids are able to go and get food at those hubs. This past year, when they went to the food hubs, they would receive 4 meals, so 2 breakfasts and 2 lunches, which would carry them over until the next day. And so our hubs are open Monday, Wednesday, Friday, which would carry them over for Tuesday and Thursday. So we are working on a plan for our meal hubs in terms of continuing them throughout the summer, and then we'll have a plan for the upcoming school year. In terms of food in school, we looked at a process earlier today with Children's Hospital in terms of having food kiosks so that we don't have large numbers of children going to the cafeteria or going to one location to retrieve their food. And so there was an actual physical kiosk that was at South Avondale, and we actually had some schools use it this past school year before the shutdown. And so we will continue with our meal service in terms of our food hubs, and then also kiosks to be able to offer kids food in a very safe way at school. In terms of transportation, we've been in contact with our transportation vendors about making sure, first of all, that our kids are safe. So the sanitizing and the cleanliness of the buses, and then also the social distancing that will need to be in place on the buses. We've also looked at other preventative measures in terms of a possible temperature check and masking before getting on the bus, although I did hear some very interesting information from the physicians at Children's Hospital today that gave us another way to think about that. So we're also potentially looking at monitors, people being on the bus to be able to support and make sure that our kids are safe. But we're still finalizing the details around that. Yes, so we're pretty far along in our planning, although quite honestly, we have a lot more work to do in terms of dotting our I's and crossing our T's. So we have a curriculum in place for each content area that we'll be using. We are already working on our distribution of technology in terms of devices. Our teachers over the last 10, 12 weeks logged thousands of hours in professional development related to delivering teaching and instruction digitally. We are working on making sure that our teachers are able to connect with our kids through a digital format in terms of a Google Meet session, which quite honestly, those were pretty successful the last 10 weeks of the school year. And so we already know that we have a plan in terms of the curriculum that we're going to use, the device deployment, the Wi-Fi for our students, and so, as well as the training for our teachers. So we're pretty far along, but there are still some things that we need to fine tune. We will use August when our teachers and principals come back to really fine tune the individual plans across all of our sites. We are looking at standards in terms of, as opposed to teaching 50 million standards, really focusing on a few of the key standards for each grade level by content, and then being able to deliver that information. Yes, so first of all, we know that as we begin the upcoming school year, we need to do a little backtracking when our kids come into school to say, okay, here's where you were at the end of last school year, and we can't just move directly quite quickly into the next curriculum. And so we're going to do a bit of a review at the beginning of the school year to level set our young people. We will also do some diagnostic assessments to see where our young people are in terms of any loss that may have taken place over the summer or due to the fact that they weren't meeting with their teacher on a daily basis to be able to develop individualized plans for our young people. We did put in place over the summer months workbooks for our families to have access to at the elementary level, and so those workbooks are given out at schools so that parents can start to get that information to help stave off any summer loss. But we know that there's a little bit of back work that we need to do in terms of looking at where our kids were and when they left in March and where they are now to be able to really build a plan to move forward. But we'll have to have more individualized, customized plans for our young people, which really, blended learning can really help actually move our kids in that direction, because with blended learning, you can move as fast or as slow as you need to, and so we just have to be a lot more flexible in thinking about the work moving forward. But we'll have some diagnostics to see where our kids are at the very beginning of the school year. So I cannot give you a number at this time. Now that we have our plan in terms of the board's decision, we'll be able to move together firmly on a specific plan. So what we've been doing, quite honestly, is planning for like 5 different scenarios. And so now that we have the plan, we will be able to move a little bit more firmly on that. If you can imagine that if you have half of the students there, you don't necessarily need the same number of staff that you would have if all of the students were there. And so that gives you some indication in terms of some changes that may need to happen as it relates to staffing. But I would be reluctant to give you specifics right now until we have a chance to sit down and talk with the board about those staffing decisions as it relates to contract negotiations. So I cannot tell you the exact numbers at this time or the employee complement until we've had an opportunity to discuss it with the board. Mm-hmm. Absolutely. Sure, that piece is probably the piece that will require the most work. So I can imagine that there will be parents who will need to get back to work and will have to figure out a childcare solution. And so do we have a bank of organizations who are ready to be able to fill that need? At this moment, I cannot tell you that we do. But I think that it's important for parents to know that they should start to think about what are some childcare options that they may consider for the upcoming school year. Yes, so we are a part of quite a few different associations, and so the Hamilton County Superintendents get together on a weekly basis and talk. The Urban 8 get together, so that will be the large urban districts in the state of Ohio: Columbus, Cleveland, Toledo, Cincinnati, Akron, Dayton. And then also we do talk with superintendents from across the nation through the Council of Great City Schools. And so we're seeing a wide range of what school districts are deciding to do, from coming back full-time, 5 days a week, to a model very similar to the model that we're using with CPS. So we're seeing a wide range. To be very transparent, we did not see anything that was dramatically different than what we had discussed within CPS. We also looked at countries abroad as well. There are, definitely. So, and I won't name the business right now, but just last Friday, a business called me and says, "Laura, we pledged $50,000 to pay for Wi-Fi. And that'll cover about 250 of your kids," which we're really excited about. And so there are a lot of organizations and companies who are coming forward saying that we want to donate, we want to help. The approximate cost is about $200 for an entire year of free Wi-Fi for our students. And so we couch it that way because there are individuals who are interested and willing to donate $200 for the cause. And it sounds a little bit better than raising $1.9 million. So we're exploring how our food will be distributed once the school year begins. Especially, we'll have to have a really good plan for winter months and thinking about how will our kids get access to food during those winter months. So we're finalizing those plans. But again, we're working with Children's Hospital to help us figure all of these pieces out. They have their quality improvement division that's working with us, as well as their Department for Infectious Control. So we're extremely fortunate to have them. They are one of the leaders in quality improvement and systems development. Sure. Yes, so we have an entire department that's dedicated to students with exceptionalities, and so that team is working on what the plan will look like for our students with disabilities. We learned a lot based upon the 10 weeks in which our buildings were closed, and so we may have to have a different model for students who have disabilities, or students who speak English as a second language, or a different model for kids who are gifted. And so I think this is just the opportunity for us to customize what teaching and learning looks like for our young people, but definitely we're looking at our students with disabilities. I believe that the board is looking at a policy now, but the research and the science really points to social distancing as well as the mask wearing. So I am excited to say that the health department donated thousands of masks to us for our adults. We have an order in for masks for children and for adults. If you enter the Ed Center now, you must wear a mask. You must go through the health assessment. Our school offices are currently open, and to go into one of those facilities, you have to have a mask as well as a health assessment. And so we're listening to what our healthcare professionals are telling us and using the science regarding mask wearing. Thank you, everyone.